15 Worst Side Effects of Amlodipine You Should Never Ignore. If you're taking this common blood pressure medication and suddenly notice unexplained swelling, difficulty breathing, or extreme fatigue, stop everything and pay attention, because one of these symptoms could be your body's early warning sign. What you're about to discover may completely change how you view a drug that is prescribed to millions every year. While amlodipine is highly effective in lowering blood pressure and preventing heart attacks, some of its hidden side effects are severe, overlooked, and potentially life. Most patients never realize that their chronic discomfort, strange physical sensations, or sudden emotional shifts could actually be caused by their medication. And side effect number 8 alone sends thousands to the ER every year. Whether you've just started amlodipine or have been taking it for years, this information could make the difference between silent suffering and safe, informed treatment. Amlodipine is currently one of the most prescribed medications in the United States, with over 70 million prescriptions filled each year. That is nearly 1 in 3 adults over the age of 40. But what most people don't realize is that for every official report of a side effect, at least 10 more go unreported. Patients often dismiss their symptoms as unrelated, while doctors may overlook the subtle signs unless they're severe. According to pharmaceutical safety data, 1 in every 8 users experiences adverse reactions, and in many cases, the connection isn't made until the damage is already done. Side effect number 8, in particular, is so commonly ignored that it accounts for emergency room visits in roughly 15% of long-term users. If these side effects go unrecognized, the consequences can be devastating, including liver damage, neurological impairment, and dangerous cardiovascular events. That's why understanding the risks, no matter how rare or subtle, is critical for anyone taking amlodipine. Recognizing the early signs can be the difference between a manageable adjustment and a medical crisis. Before we go any further, let's be absolutely clear. This video is not here to scare you, and it's certainly not suggesting that you stop taking your medication without medical supervision. That would be both dangerous and irresponsible. It's easy to fall into extremes when it comes to medication. Some believe all pharmaceuticals are toxic and should be avoided entirely, while others assume that if a drug is prescribed, it must be completely safe. The truth lies somewhere in between. Amlodipine is an effective medication that has saved countless lives, but like any drug, it carries risks that deserve attention. The goal here is education, not alarm. When you know what to look for, you can work with your doctor to adjust your treatment safely and effectively. Over the next few minutes, we're going to break down the 15 most serious side effects of amlodipine, what causes them, how to spot them early, and what to do if they appear. Some of them are well known, others are rarely discussed, and at least one affects nearly 1/3 of all users without them even realizing it. 1. Peripheral edema. One of the most common and visible side effects of amlodipine is peripheral edema, a buildup of fluid that causes swelling in the feet, ankles, and lower legs. This occurs in up to 10 to 15% of patients and often worsens gradually over time. Most people first notice it when their shoes feel tighter, socks leave deep marks, or there's a puffy, heavy feeling in their legs by the end of the day. The reason? Amlodipine works by relaxing and widening blood vessels to reduce blood pressure, but in doing so, it allows fluid to leak from the bloodstream into surrounding tissues, particularly in the lower extremities where gravity pulls it down. Women are more commonly affected, and the risk increases with higher doses. While the swelling is usually painless, it can be uncomfortable and affect your ability to walk or stand for long periods. If left unaddressed, it may also contribute to longer-term circulation problems. Noticing this side effect early and discussing it with your healthcare provider could prevent unnecessary discomfort or complications down the line. 2. Angioedema is a rare but potentially life-threatening side effect of amlodipine that causes sudden swelling in the deeper layers of the skin, especially around the face, lips, tongue, and throat. Unlike regular puffiness or mild allergic reactions, this type of swelling comes on quickly and can escalate within minutes to hours, sometimes severely enough to block the airway and cause difficulty breathing or swallowing. Patients may first notice a tingling or burning sensation before the swelling becomes visibly pronounced, often on one side of the face more than the other. In the most dangerous cases, the throat can swell shut, requiring emergency treatment or even intubation. What makes angioedema particularly alarming is its unpredictability. It can occur at any time, even after months or years of taking amlodipine without previous issues. The condition stems from the release of inflammatory chemicals in the body, which increase blood vessel permeability and allow fluid to leak into surrounding tissues. If you ever experience unexplained facial swelling, especially with breathing problems, stop taking the medication and seek emergency care immediately. This is not a symptom to wait on or second guess. 3. Hepatotoxicity. Although relatively rare, Amlodipine-induced liver toxicity, known as hepatotoxicity, can become serious very quickly. In documented cases, patients developed sharp increases in liver enzymes within just days to weeks of starting the medication, a clear sign that liver cells were being damaged. Symptoms often start subtly: fatigue, nausea, loss of appetite, or mild discomfort in the upper abdomen. But in some cases, the condition escalates rapidly, leading to jaundice, a yellowing of the skin and eyes, along with dark urine and pale stools. These signs point to significant liver dysfunction and require immediate medical attention. The underlying mechanism is thought to involve reactive metabolites produced during amlodipinase breakdown in the liver, which may overwhelm the body's detoxification systems and trigger an immune response. Fortunately, most patients recover fully after discontinuing the drug, but recovery can take weeks or even months. And in severe cases, the damage may be lasting. Because the liver is silent until it's in real trouble, any unexplained fatigue, yellowing of the skin, or digestive changes while on amlodipine should never be ignored. 4. Peripheral neuropathy. Peripheral neuropathy is a lesser-known but deeply disruptive side effect of amlodipine. It involves gradual damage to the nerves outside the brain and spinal cord, particularly those in the hands, feet, and lower legs. For many patients, it begins subtly, a pins and needles sensation in the toes or fingertips, or occasional numbness. But over time, the symptoms can intensify into burning pain, electric shock-like jolts, or a loss of touch sensitivity. Some people describe it as walking on glass or sandpaper. In more advanced cases, peripheral neuropathy affects motor function, leading to muscle weakness, unsteady balance, and an increased risk of falls. Even simple tasks like buttoning a shirt, holding a pen, or walking barefoot can become difficult. While the exact mechanism isn't fully understood, amlodipine's interference with calcium channels in nerve cells may disrupt normal signal transmission, causing progressive degeneration. The longer the medication is taken, especially at higher doses, the greater the risk. And recovery, if it happens, is often slow and incomplete. If you begin noticing numbness, tingling, or unusual pain in your limbs while on amlodipine, it's critical to bring it up with your doctor immediately. 5. Extrapyramidal symptoms. Though rare, amlodipine can cause serious neurological side effects known as extrapyramidal symptoms. These involve dysfunction in the part of the brain that controls involuntary movements and coordination, leading to symptoms similar to those seen with certain psychiatric medications. Patients may experience muscle stiffness, uncontrollable tremors, and involuntary muscle contractions called dystonia, which cause twisting or repetitive movements and abnormal postures. For example, cervical dystonia may cause the neck to twist painfully, while limb dystonia affects arms or legs. These symptoms are often distressing and can interfere with walking, speaking, swallowing, and even facial expressions. Other issues include restlessness, akathisia, and abnormal eye movements, oculogeric crisis, which add to the discomfort and social embarrassment. The exact cause is unclear, but may involve amlodipine's impact on dopamine pathways in the brain. Because these symptoms mimic other neurological disorders, they can be misdiagnosed, leading to ineffective treatments. Early recognition and medical evaluation are crucial to managing these effects and preserving quality of life. 6. Severe cardiovascular effects. While amlodipine is designed to lower blood pressure and protect the heart, paradoxically, it can sometimes worsen chest pain or even trigger heart attacks in certain patients, especially when starting treatment or increasing the dose. This happens through a phenomenon called coronary steal syndrome, where the drug dilates healthy coronary arteries more than the narrowed ones, diverting blood away from already compromised heart muscle areas. As a result, angina symptoms may intensify, or a myocardial infarction heart attack can occur. Additionally, amlodipine can cause severe hypotension, dangerously low blood pressure leading to dizziness, fainting, falls, and organ damage due to inadequate blood flow. Some patients also develop serious heart rhythm disturbances, such as bradycardia, slow heart rate, or tachycardia, fast heart rate, both of which can impair heart function and require urgent medical care. These cardiovascular risks are higher in elderly patients and those with pre-existing heart disease. Close monitoring is essential during the initial treatment. Phase 2, catch and manage these potentially life-threatening side effects early. 7. En taste disturbances. Amlodipine can cause a rare but troubling side effect known as dysgeusia, where your sense of taste is either lost completely or severely altered. This can happen suddenly and usually affects the front two-thirds of the tongue, which detects sweet, salty, and umami flavors. Some patients experience a metallic or bitter taste, while others might find that all foods taste bland or unpleasant. This change in taste perception can make eating unenjoyable and even risky, as it may become harder to detect spoiled food, increasing the chance of food poisoning. The impact on nutrition and quality of life can be significant, leading to weight loss, nutritional deficiencies, and social withdrawal from shared meals. The exact cause isn't fully understood, but it's believed amlodipine interferes with calcium channels in taste receptor cells, disrupting normal taste signals. 8. Gingival hyperplasia. Amlodipine can cause a distinctive side effect called gingival hyperplasia, which is an abnormal overgrowth of gum tissue. This condition affects about 1.7 to 3.3% of patients, with men experiencing it more frequently. The gum overgrowth usually starts within the first 3 months of treatment and can worsen if left untreated, sometimes covering parts of the teeth and making oral care difficult. This occurs because amlodipine affects calcium metabolism and collagen production in the gums, leading to excess fibrous tissue buildup. The presence of dental plaque and irritation can worsen the condition by triggering inflammation. Initially, patients might notice thickening between their teeth, but over time, the gums can become firm, enlarged, and either pale pink or reddish, depending on inflammation. This overgrowth can interfere with chewing, speaking, and maintaining oral hygiene, and it may cause cosmetic concerns that affect confidence and social interactions. 9. Severe psychological effects. Amlodipine can cause serious psychological side effects that significantly impact daily life. Many patients report severe anxiety, panic attacks, and depression while taking this medication. Panic attacks may involve sudden, intense fear, rapid heartbeat, sweating, and feelings of impending doom. Some patients feel overwhelming anxiety or fear that they are dying, which can disrupt work, relationships, and normal activities. Agoraphobia, or fear of leaving the house, may develop in some cases. Sleep problems such as insomnia and nightmares are common, worsening anxiety and depression in a cycle that can be hard to break. Depression symptoms include persistent sadness, loss of interest in activities, feelings of worthlessness, changes in appetite, difficulty concentrating, and even thoughts of self-harm. Mood swings and irritability are also frequent, with rapid changes in emotional state that family members might notice as personality changes or increased aggression. These psychological effects are often misunderstood as primary psychiatric conditions, so recognizing them as potential medication side effects is crucial for proper management. 10. Skin rash. Skin rashes are a broad but important category of side effects linked to amlodipine use. In most cases, the reaction appears as a maculopapular rash, flat red spots with small raised bumps, often itchy or tender, and usually spreading across the torso, arms, and legs. This type of rash may be uncomfortable but manageable. However, in rare but severe instances, amlodipine can trigger life-threatening skin conditions, such as Stevens-Johnson syndrome, SJS, or toxic epidermal necrolysis 10. These reactions involve widespread skin blistering, peeling, and extreme sensitivity, and require immediate hospitalization. The cause of these rashes is typically immune-related, involving either immediate allergic responses or delayed hypersensitivity reactions depending on the individual. A common warning sign is a spreading rash accompanied by fever, burning skin, or mucosal involvement, such as sores in the mouth or eyes. Patients must not ignore these symptoms, as early detection can mean the difference between full recovery and serious complications, including infection, fluid loss, or even organ failure. 11. Flushing. Flushing is a common but often overlooked side effect of amlodipine. It's characterized by sudden warmth, redness, and a sensation of heat, typically in the face, neck, or upper chest. These episodes can be mild and fleeting or more intense and persistent, sometimes accompanied by sweating or a flushed appearance that's noticeable in social or professional settings. This happens because amlodipine relaxes blood vessels by blocking calcium channels, which increases blood flow to the skin. While harmless in most cases, flushing can be uncomfortable and embarrassing, particularly when it occurs unpredictably or frequently. Some patients report a burning sensation or feel overheated, even in cool environments. The good news is that this side effect often fades over time as the body adjusts to the medication. However, if flushing is severe or paired with other symptoms like dizziness, chest discomfort, or difficulty breathing, it may signal a more serious issue and should be evaluated by a healthcare provider. 12. Constipation. Constipation is one of the more common and often underestimated side effects of amlodipine. Characterized by infrequent, hard, or incomplete bowel movements, it can lead to significant discomfort, bloating, and strain. This side effect occurs because amlodipine, as a calcium channel blocker, relaxes the smooth muscles not only in blood vessels, but also in the intestinal walls, slowing down the movement of food through the digestive tract. As a result, more water is absorbed from the stool, making it harder and more difficult to pass. In some patients, constipation becomes chronic and severe enough to interfere with daily life, leading to complications like hemorrhoids, anal fissures, or even fecal impact. It can also increase the risk of urinary tract infections, especially in older adults. For patients already prone to digestive issues, amlodipine may significantly worsen gut motility. If left untreated, persistent constipation can spiral into a cycle of discomfort, reduced appetite, and nutritional imbalances, making it essential to address early with dietary changes, hydration, or, if necessary, medical treatment. 13. Sexual dysfunction. Sexual dysfunction is a less frequently discussed but impactful side effect of amlodipine, affecting both men and women in different ways. In men, it may present as decreased libido, difficulty achieving or maintaining an erection, erectile dysfunction, or delayed ejaculation. Women may experience reduced sexual desire, vaginal dryness, or discomfort during intercourse. These changes are often subtle at first, but can worsen over time, affecting relationships, self-esteem, and emotional well-being. The likely cause is amlodipine's effect on blood flow and smooth muscle relaxation, which can interfere with normal vascular and neurological function in the reproductive system. Hormonal shifts and the psychological impact of other amlodipine side effects, such as anxiety, fatigue, or depression, can further contribute to a decline in sexual health. Unfortunately, many patients don't report these symptoms due to embarrassment or the mistaken belief that they are unrelated to the medication. Recognizing sexual dysfunction as a possible side effect is important, as it may be reversible with dosage adjustment or alternative treatment under medical supervision.